Imagine this scenario. You're alone at home, perhaps watching TV or reading a book, when suddenly you feel that crushing weight on your chest. Your left arm goes numb. You can't catch your breath. You are having a heart attack, and there is nobody around to help. This terrifying situation happens to over 380,000 Americans every single year who experience heart attacks while completely alone. And here is the shocking part that most people don't know. A groundbreaking study from the European Heart Journal found that seniors who knew exactly what to do in the first 60 seconds of a heart attack increased their survival chances by an astounding 73%. That's right. Knowing what to do in just 1 minute can literally mean the difference between life and death. But here's what's even more surprising. The same research revealed that 89% of people over 60 have absolutely no idea what the correct steps are when they're alone during a cardiac event. They panic, they freeze, or worse, they do things that actually decrease their chances of survival. Today, I am going to share the scientifically proven techniques that could save your life if you ever find yourself in this nightmare scenario. These aren't old wives' tales or internet myths. These are evidence-based strategies backed by cardiologists and emergency medicine experts from institutions like Johns Hopkins and the Mayo Clinic. And here's something that will blow your mind about the most important tip I'm going to give you. Researchers at Harvard Medical School discovered that one single action, when performed correctly, gives you the same survival advantage as having a paramedic right there in your living room. It's so powerful that emergency dispatchers are now being trained to coach people through it over the phone. And it has absolutely nothing to do with aspirin. Before we begin, tell us in the comments now your age and where you're watching us from. We're reading and replying to every single comment, so drop your comments below. Now let's begin. The moment you feel those symptoms, the chest pressure, the arm pain, the shortness of breath, the nausea, your 60-second clock starts. The very first thing you must do, while you still have strength and coordination, is get to your front door and unlock it. This life-saving tip addresses a terrifying reality that kills thousands of seniors every year. Paramedics arriving at your home but unable to get inside. A study from the Journal of Emergency Medical Services tracked 500 cardiac emergencies and found that locked doors delayed treatment by an average of 11 minutes, with 34% of cardiac deaths in seniors occurring simply because help couldn't reach them in time. The University of Pennsylvania found that patients who unlocked their doors as their very first action had 47% better survival rates than those who waited until after calling 911. Why? Because the average person loses the ability to walk within 3 to 5 minutes of a major heart attack starting. Once you are on the ground, you are not getting back up to unlock that door. With the door unlocked, your next immediate action is to call 911. This is where your preparation becomes critical. When cardiac arrest begins, your brain starts losing oxygen immediately. Within 15 to 30 seconds, you might experience confusion, disorientation, or even temporary paralysis. A study in the Journal of Emergency Medicine found that 67% of heart attack survivors over 60 couldn't remember their own address when calling 911. Not because of memory problems, but because oxygen deprivation instantly affects cognitive function. This is why today you must write your complete address, including your apartment number, on a bright colored index card and tape it directly next to every phone in your house. Program 911 into your speed dial as number 1 on every phone. When your fingers are shaking, hitting one button is infinitely easier than pressing 3 in the right sequence. While you are on the line with that 911 dispatcher, you must act. The most well-known advice is to take aspirin, but there's a specific way to do it that makes it work up to 50% faster. You must chew the aspirin, not swallow it whole. A major study in The Lancet found that taking aspirin within the first hour reduced death rates by 23%. But chewing it breaks down the tablet's coating and allows it to be absorbed through the lining of your mouth, rather than waiting for it to dissolve in your stomach. Research showed that chewed aspirin reached therapeutic blood levels in 14 minutes compared to 26 minutes for swallowed tablets. Those 12 minutes matter enormously when your heart muscle is dying. The correct dose is 325 milligrams, 1 regular strength tablet or 4 baby aspirins. Keep non-coated aspirin in multiple locations and check the expiration dates. But now, for that Harvard-backed secret, the most powerful action you can take. If you have any cardiac risk factors, being over 60, having high blood pressure, diabetes, or a family history, you must talk to your doctor about getting a prescription for emergency nitroglycerin. Nitroglycerin works by rapidly dilating your blood vessels, reducing the workload on your heart, and improving blood flow. It can literally stop a heart attack in progress. A British medical journal study showed that early nitroglycerin use reduced mortality by 35%. Here is the correct protocol at the first sign of symptoms. Sit down. Never take it standing up. as it can make you faint. Place one tablet under your tongue and let it dissolve. Set a timer for 5 minutes. If your symptoms haven't improved, take a second tablet. Set another 5-minute timer. If symptoms persist, take a third tablet. Never take more than 3 tablets in 15 minutes. And here is the critical warning: if you take erectile dysfunction medications like Viagra or Cialis, you cannot take nitroglycerin. The combination can cause a fatal drop in blood pressure. Now that you've unlocked the door, called 911, and taken your emergency medication, you must position your body to survive the wait. Do not lie flat on your back. This can actually reduce blood return to your heart and make symptoms worse. Instead, you must assume the cardiac position. Sit up at about a 45-degree angle, propped against a wall or using pillows. Your knees should be bent. This is called the Fowler's position. It reduces the workload on your heart, makes breathing easier by allowing your diaphragm to expand, and helps prevent fluid from backing up into your lungs. A Tokyo Medical University study found patients in this position had 35% better oxygen saturation. Loosen any tight clothing, your belt, your collar. This simple act can improve blood oxygen levels. And as you sit, you must control your breathing. Your instinct is to hyperventilate. This panic response actually makes everything worse by reducing the amount of oxygen reaching your heart. Stanford University found that patients who use controlled breathing had 45% less heart muscle damage. The technique is called paced diaphragmatic breathing. Breathe in slowly through your nose for a count of 4, feeling your belly expand. Hold that breath for a count of 4. Then, exhale slowly through pursed lips for a count of 6. The longer exhale is crucial. It activates your parasympathetic nervous system, which slows your heart rate and reduces the oxygen demand on your heart. Put one hand on your chest and one on your belly. The hand on your belly should move more. Finally, what if you feel yourself losing consciousness before help arrives? There is a controversial but potentially life-saving technique you can use in those last-ditch moments: cough CPR. This only works if you are still conscious. At the very first sign of fading, take a breath as deep as you possibly can. Then cough hard and deep, as if you're trying to cough up something from your diaphragm. Repeat this cycle. Every 2 seconds, breathe in deeply. Cough hard. Each forceful cough squeezes your heart and keeps blood circulating, maintaining blood flow to your brain for an average of 92 seconds longer. That may be just enough time for the paramedics to get through the door you've already unlocked. These techniques could literally be the difference between life and death, but they all depend on one thing: preparation. Practice these techniques now when you are calm. Run through the breathing exercises. Check your aspirin supplies. And most importantly, talk to your doctor today about a prescription for emergency nitroglycerin. Make sure your emergency address card is by your phone. Get a medical alert device if you live alone, and wear it even in the shower. Give a trusted neighbor a spare key. Your heart and your loved ones will thank you for being prepared.